Deze podcast is mede mogelijk gemaakt door de vriendelijke steun van Dr. Paul Hobbe en zijn team. Dank daarvoor.
Hello and welcome to HetMedischKompas. Today with us we have Dr. Malcom Steinberg. He's a distinguished expert in public health, epidemiology and health strategy. Dr. Steinberg is an associate professor and director of public health in the Faculty of Health Sciences at Simon Fraser University in Canada. He also serves as an honorary lecturer at the University of KwaZulu-Natal, where he is advancing efforts to integrate traditional health practitioners into South Africa's healthcare system, particularly addressing cervical cancer. Dr. Steinberg's career spans decades and continents. He's managed two national health programs in South Africa, including a national HIV/AIDS program of the Research Council, and co-founded occupational health NGO to support health and safety initiatives for the Black trade union movement during a transformative period in the country's history. Currently, as a physician epidemiologist at the British Columbia Centre for Disease Control, Dr. Steinberg leads research including a Canadian Institute of Health research study investigating acute HIV infection in gay men, and collaborative project in Uganda exploring HPV self-collection for cervical cancer screening. Now, welcome.
Thank you. It's wonderful to be with you.
So, to start off, I would love to know, is there someone in your career who's had a large influence on you or who's inspired you in what you're doing?
Yes, I did my master's in epidemiology at the London School of Tropical Medicine, Hygiene and Tropical Medicine, and I came across many epidemiologists who are very, very inspiring, who really opened up my understanding about prevention and moving upstream. And I think that one of the guests that we were exposed to was Michael Marmot, who eventually went on to lead the Commission of Inquiry, the WHO Commission Inquiry into the social determinants of health. And it really, made me realize that we were being trained as physicians and doctors and healthcare practitioners to really look at outcomes and to really just, have a curative approach to our interventions without really thinking about what lies upstream and what interventions we could make.
Yeah, wonderful introduction. Okay, so what we're really interested in is what work are you currently involved in? We introduced in the introduction in regards to preventative or work with the HIV and the cervical cancer screening. Can you tell us more about that work?
Yes. So I'm actually currently on sabbatical in South Africa, where I have an adjunct position with the Traditional Medicine Unit in the Faculty of Nursing and the School of Public Health at the University of KwaZulu-Natal. And two projects that I'm involved in there. One is to look generally at the integration of traditional healers into the healthcare system. And that is because there's recognition that the vast majority of people in South Africa consult traditional healers, and that physicians trained through the Western medical system are really not exposed to traditional healing practices, and so are unable to have those dialogues with their patients. And so that information is kept out of the consultation and really mitigates against a wholesome and a full and complete healing process. So we're trying to work with the regulations and the transformative initiatives in South Africa, which have established legal precedents to recognize traditional healers. But now we have to overcome the discrimination and stigmatization against traditional healers. So what we're trying to do in the Traditional Medicine Unit there is to do pilot work and collaborative work with traditional healers. And so in the area of cancer of the cervix, I'm particularly interested in recognizing that most women in Southern Africa and many lower and middle income countries never get screened for cancer of the cervix. And so what I've been doing there is to try and build projects where traditional healers can counsel their clients about cancer of the cervix and invite them to do a self-collection, which is a very simple, non-invasive procedure in which a woman can introduce a tampon into the vagina to pick up some vaginal fluid, which can be tested for HPV viruses. And those women that have positive tests would then go on to further investigations to see whether there are precancerous changes on the cervix. And often those can be identified very early on and can be curative.
And then, so if I understand this right, the traditional healing integration is simply because it allows access then to the patient and builds trust? Or are you arguing that it's an effective therapeutic technique as an adjunction to classical Western medicine?
So that's a really interesting question. And I'm arguing actually for both. So, the story I've told is a recognition that women don't have access or have very poor access to screening for cancer of the cervix and for many other issues as well. So working in partnership with traditional healers who are based within the community, who have built up trust with their community, can actually extend screening for cancer of the cervix in that situation. But we're also working with traditional healers we first build memorandum of understanding with them. And then once we've established that trusting relationship, they share their formularies with us, their herbal formularies with us. And we then take those herbal formularies, and often we are blinded to exactly what they are, and prepare standard preparations. And in our laboratory there, we then test those herbal formularies for anti-inflammatory, anti-neoplastic, antimicrobial, and anti-viral properties, for example. So we are able to extend the knowledge about these herbal formularies that then can go back to the traditional healers. And through the memorandum of understanding, we can protect those knowledges so that they're not necessarily appropriated by pharmaceutical companies, for example. Mm-hmm. And we're really excited by these developments. It's referred to in the literature as reverse pharmacology, because as you know, the usual route is that all these weird and wonderful drug candidates are discovered in the laboratory, and then they are put through the various trials and tests, and eventually the research would then be done on human beings. But what you're seeing here is that you're starting off with the use in human beings, and the observational data of the traditional healers is then the starting point, and you then reverse that back. So that's why it's called reverse pharmacology.
Yeah. How do you handle the information that comes out of this research? So because let's say it could work or it could not work, and that could have impact on the relationship and the trust you have with the healer. So how do you deal with that?
Absolutely. So the partnerships enable us to build and extend a relationship, and so that we can slowly introduce the healers to the Western systems that allows them then to negotiate the use of that knowledge. So we currently have a very, very exciting project in the laboratory. Many years ago, members of the laboratory met with some traditional healers who were working with a herbal formulary that they had. This is a father and son who had learnt about this formulary from their grandfather, so the lineage continued, and he had been using it for syphilis. And so they thought, well, if it worked for syphilis, what about HIV? And to cut a long story short, they started seeing very good results with their formula being used on HIV. Yeah. And to cut to the present, we have now taken their formula, and we have gone past demonstrating that it has anti-HIV properties, yeah. And it is now going into clinical trials.
Wow.
So what I would worry about is you see a lot of times when traditional healing leads to damage, for example, traditional bone setters, and you see necrotic arms of young children. And what I would worry about is where do you then set the boundary and communicate evidence-based medicine against non-evidence-based medicine? Because once you allow the traditional medicine in, then you allow everything.
Yes. So, we're not advocating sort of an open door policy on this. And I think that the South African situation has approached this quite wisely. They first recognized that in the early 50s, I think it was in 56, there was a law passed during the apartheid government in South Africa, which suppressed indigenous knowledge systems and actually made it illegal to practice as an indigenous practitioner. And so they first wanted to establish a legal precedent to recognize traditional healers. And now the work that's being done is to set up regulatory mechanisms and to try and create a system where the knowledge that is out there is allowed to flourish and develop. And that includes, doing research, trying to understand these practices, regulating them, creating ethical systems, protecting patients and clients. One must recognize that in poverty-stricken situations, people will do, where you've got very, very high unemployment rates, and people will do anything to find ways to earn money, and unfortunately, some people have gone into illegal traditional healing practices, and some of those have been very damaging. So I think we need to understand this within context, but we definitely need regulatory mechanisms just as much as we have them for Western medicine.
What are examples of these regulatory mechanisms? So
this is very early work. The first is to try and build up a database of who is practicing out there. And what has been suggested is that traditional healers would be required to register. And once they register, then they would be recognized as practitioners, and so would open themselves up to accreditation initiatives as well as networking initiatives. So that's the first step, is to get people into a database and to get people registered.
How do you then go on and approach them and then make sure you have a trust relationship? It takes time, and as I've heard before, you cultivate the respect from both sides, but how do you concretely do that?
Well, what we're finding is that traditional healers have their own governance systems, their own organizations, their own councils. We work through those councils. And so, a lot of effort it needs to go into to support the development of organizing traditional healers into these into these democratic structures, so that they can really develop mechanisms to oversee their own practices.
Yeah, so actually try to bring some kind of structure from within and not from the without. So
exactly.
Encourage them to do so. That's very interesting.
Right.
I have another question, because I did I worked in a hospital in Suriname in South America in the summer, and I had some pregnant women who were chewing on some kind of herbs, and it was very new for me. But I was wondering, as a physician, let's say I have a patient that comes in with these practices. Of course, I have a Western kind of way of looking at things, but how could I best approach my patient and establish a trust relationship and see what's best for them?
Yes, this is the area that is probably most immediate and in most immediate need of attention within medical schools and within healthcare training, and that is to develop an approach of cultural safety. This is a concept that we're working with a lot in Canada, where in recognition of experiences that Indigenous people have had in healthcare systems where they've been discriminated against, that patients will find an opportunity to have a culturally safe experience. So I think that requires respect and trust and non-stigmatizing attitudes of the healthcare practitioner, so that the patient and client can discuss their experiences with healthcare access outside the Western healthcare system. So I think it's opening the dialogue and not having a judgmental approach.
Mm-hmm.
And then, not providing prescriptive instructions about what patients should or shouldn't do, but just to keep the dialogue open.
Yeah.
So if I hear correctly, one of the big benefits that we're achieving with this integration is greater agency and ownership over health and access to health in these communities. Can that not be achieved through the Western medicine methods as well?
Yes, I think that one of the beautiful things about the collaboration between Western and traditional medicine is learning from one another.
Mm-hmm.
And I think Western medicine in general doesn't have a holistic approach. And so, I think that, we can take the learnings from indigenous medicine, seeing the whole patient, trying to understand their position within communities and their relationship to their societies and how they view health, and bring that into our own practices.
Yeah.
I don't think, it's not an issue of either or. And, we need to recognize that in the Western healthcare system, the majority of our clients and patients engage with homeopathy, podiatry, naturopathy. They go to massage therapists. They go to, there are many so-called healthcare providers that are engaged outside the Western biomedical system. And yet we don't have judgments about that. And so we need to see traditional medicine as yet another form of healthcare practice.
Yeah, and if I may comment your previous question, as you were posing the question, what was going through my head was, of course, it's something that traditional medicine is something that comes out of people, out of traditions, out of oneself, out of one's uniqueness. So if you take that into account, you do a patient-centered medical approach. And that is exactly what kind of medical approach will come to the patient, and the patient will embrace it and use it. And that's, I think, one of the most important things and problems that the Western medicine needs to tackle. The Western medicine prescribes and then the patient accepts, but there's not a lot of sending from the patient towards medicine, which is the more holistic way of looking at medicine. And then my question is, what are examples of, the holistic approach that traditional medicine has that Western medicine can learn from and can use in its practice?
Yeah, I think the answer to that is going to be embedded in different traditional medicine practices. And so, if you look at Ayurvedic medicine, for example, Ayurvedic medicine believes, and this is, very, 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 in a summarized a way of trying to understand this, is that we're born into the world with a particular makeup. And in Ayurvedic medicine, that is called one's prakriti, one's blueprint makeup. And the understanding amongst Ayurvedic practitioners is that we go through life and we stray away from that makeup, and we go into imbalance, and that is called one's vikriti. And so the diagnostic process there is trying to understand where the imbalance lies in terms of that person's, unique makeup. Mm-hmm. And that is determined by, diagnosing different dosha systems which make up that person. Mm-hmm. So there's a whole knowledge system, there's a whole wisdom embedded in that practice. And so, I think I'm giving an example here, of course, but if biomedical practitioners in the Western medical system could look at their patients and think, well, this patient is sitting in front of me and is in a state of imbalance. What can I do to help this person restore their own balance, their unique balance in their life? What can I do to promote that through my therapeutic practices, but also trying to understand that person's well-being and those person's sense of purpose? It starts bringing a different mindset into our thinking as biomedical practitioners.
Definitely. And what I notice here is that a lot of times somatic problems in the GP practice that we had an internship at as students, a lot of psychological or psychosocial problems cause other problems to become more, and the loss of agency over one's health is something that is a major thing that is amongst Western patients. Whereas if I go back to Cyprus, where I come from, or another more traditional place where people really just believe that what they're doing is going to help them, there's more belief towards the system of health because it also comes from them, then you see that it's the health that is being given has better effects, let's say. So how do you see that in these patients?
I think that the agency that you're talking about is the important aspect. Is that patient is empowered to call on their own agency to support their own healing processes. So I think that's if that can be legitimized and encouraged and enabled within the consultation, then things. I think that just creates a better situation for healing.
Definitely. And then, so we start a little bit with trust, with agency, and then we go on to concretely these practices. And some of them may have very good anti-inflammatory effects, and some of them may really be harmful. How do we communicate that? How do we tell that to them?
I think that we need to encourage people to step forward if they develop any adverse symptoms or they feel unwell, and to keep the consultation open.
How can they recognize that they are unwell? Because these practices that are traditional, are lifelong, and people may have a different threshold for suffering, different understanding of what is good and what is not. How do you?
No, these are difficult questions. I think that one can only encourage patients and clients who one sees in Western medical practices who have disclosed or have shared that they are using traditional practices to work carefully with those practices and to look out for any side effects and to step forward and to share those if those arise.
And when I think about the Western world and I think about acupuncture, I'm a little bit blinded to it because I've grown up in this environment, but I have the idea, people sometimes even there's a baseline of education that is widespread, and maybe in some poorer countries there's less education about some side effects or some dangers. So how do you make sure people are well educated?
Yeah, I think that we need to be much more trusting of systems that have existed for millennia. So long before, Western medical systems are probably a little bit more than 200 years old. We're talking about systems that have probably been around for thousands and, much longer. And people survived those systems. They thrived in those systems. Those systems were developed over such a long period of time through so much natural observation about what works, what doesn't work. And we're only beginning to understand them. So I think that, we need to take away a desire to control the situation and to trust the situation.
So how can we learn that? How can we learn to trust and let off the controlling feeling that we think we have as practitioners?
I think that if a patient says, I'm feeling quite anxious and I get quite nervous, but I find that, if I have a cup of chamomile tea before I go to bed, I sleep better. We're not going to, become suspicious about that. But chamomile is a flower that grows in the garden. It's a herb. And so if another patient walks in and says, I've seen a traditional healer and I was given some herbal medicine, I think we should have the same attitude as we have towards chamomile tea.
Mm-hmm. Oh.
So I'd like to ask a question. You made the argument that over long periods of time, that constitutes then evidence for something being effective if it's been present for an extended period of time. But I would like to meet that with some skepticism in that what we do as humans is we build rituals, we build practices that aren't necessarily based on evidence-based outcomes. So I would argue that the extended time of practice of different treatments isn't necessarily a good evidence for their efficacy. It's good evidence for that they've been repeated.
So, the hierarchy of evidence which you're inferring, which becomes a holy grail for us in biomedical Western science, that everything needs to be taken, to double-blinded, randomized controlled trials, and that the only evidence that we're going to produce is from systematic reviews and meta-analyses from tons and tons of data that's highly, highly controlled.
Mm-hmm.
I think we need to recognize that is, a valuable methodology to verify evidence. But that if we put that against millennia of observational data, I think that we're looking at evidence paradigmatically in different ways. And yes, we may not be as confident about all the biases that might be present, but the consistency of observation is what's important. And I think if a herb has been used over millennia and it's been shown to have consistently been observed to have an impact, then we need to take it seriously. So, for example, in different parts of Africa, the plant Artemisia, which grows very, very commonly in certain parts of Africa, has been used for thousands of years as a herbal substance, as a herbal plant. It's drunk as tea and it's used in food and so on. And it's now being discovered that actually it has anti-malarial properties. And so, the observations that were made by those populations over time that Artemisia protected against malaria came out of observational data. So I think that we just need to respect that practices that have continued and survived over millennia are likely to have some value.
Yeah, but yet we still put them through the rigorous process of investigation that we use for other medicines. Is that correct? If I understand that?
Yes. Well, I think we can.
Mm-hmm.
And until we do so, linking to the previous questions, I don't think that we should police the use of those remedies. We need to respect that, they've been used for so long. Mm-hmm. And so allowing them to continue to be used is unlikely to be a problem.
Yeah.
And we can take those further. It's often said that one of the oldest medicines in the world is turmeric. And, turmeric is a herb that, grows commonly. We put it in our food. And we're now discovering that it's got incredible anti-inflammatory effects.
Mm-hmm.
So what does the pharmaceutical, industry do? It grabs turmeric, tries to identify, the molecule within turmeric that works. So, and now we go into the, into our pharmacies and we buy Curamin tablets instead of eating turmeric. So I think that there's a danger in trying to, push the science unnecessarily far to prove that something is effective.
What is the danger?
I think the danger is just, it's expensive to do so. It's an issue of trying to commodify natural healing ingredients and herbs, without trying to encourage, a more natural practice.
Mm-hmm. So we're trying to monetize and make a more industry around knowledge. Because
that's what we're so good at doing and what we naturally do.
Is it not possible to combine?
Well, the examples I gave you before and the approaches that we take in the traditional medicine unit in South Africa and the University of KwaZulu-Natal is a recognition that Western science and scientific approaches have a lot to offer to extend the knowledge systems in indigenous practices. And that's what we're trying to do. We're trying to work with traditional healers and saying, okay, you've got all this observational data. We're not out to stop you using those herbal formularies and in your practices. But this is an opportunity to learn more about them. And our commitment is to work with you to protect your traditional knowledges, and what we learn to give that back to you. And for you then to make a decision about how you'd like to share that with the rest of the world. So, I do think that these are important collaborations. In Canada, we often talk about how indigenous knowledge systems and Western knowledge systems interact. And there's a wonderful indigenous scholar who suggested that we approach this with a two-eyed way of seeing, that we look through one eye with a Western perspective, and we look through the other eye with an indigenous perspective. And that by looking with both eyes, we'll see more clearly. And the interesting thing is, if you look into the distance and you put your hand over one eye, you don't lose vision. You lose depth of field. And so if we can look with two knowledge systems at something, we'll get a better depth of field.
And in the gray areas where they intercept and they're different, maybe could be opposing of views, how do we handle that?
Well, when colonialists first came to Canada, and where I live in British Columbia, and they were met by the indigenous peoples there, they lived in harmony together. And there are many stories of colonial first contacts where indigenous people and colonial people met and greeted one another and lived together. And there's an old there's an old artistic discovery in British Columbia where these two people met. And the way this was expressed by indigenous people is that the artists within those communities wove what was called then a wampum belt. And the wampum belt has beads that run in parallel together. And the stories, that come out of those times is that the understanding was that the colonialists and the indigenous people would sail and paddle together in the water alongside one another, but would not interfere with one another. So I think that, it's a different kind of collaborative practice, bringing different knowledge systems together the tendency is that one knowledge system wants to dominate the other. But actually, these knowledge systems have been developed independently of one another.
Yeah.
And, we need to try and understand that. I'll give you one other example. If you look at Buddhism, includes an understanding of reincarnation. And what is being reincarnated is that the soul is moving from one body to another. Well, many indigenous practices, I believe, recognize that if the soul is going to grow productively in a body, it best grows in a body that is not diseased. And so, age-old traditional practices, I think, have focused on prevention more than cure to try and vitalize the human condition so that the soul could grow most optimally. Now, whether we believe in souls or not, or whether we believe in reincarnation or not, I think that's an incredibly rich knowledge system that can only help us with our healing.
How did they do that, the prevention part? How did they focus on prevention?
Well, when I refer to the Ayurvedic medicine systems, the belief that we're born into the world with a particular makeup, and that is probably our most perfect, balanced makeup. Now, of course, there might be diseases in utero, and a woman might not have a perfect pregnancy. But if we consider that a child born into the world is probably in its most balanced state, and then it is going to encounter all the other challenges that we all encounter, the environmental challenges and all the other challenges, and that balanced state is going to go out of balance. This was the belief.
Mm-hmm.
And so the healing process was always trying to restore a natural balance, but there wasn't one balance for everybody. It was a unique balance for each person.
Mm-hmm. And what if the child gets born with defects or health problems? How do they approach that?
I can't really answer that, but likely, there was a survival of the fittest outcome,
mm-hmm.
and
those that were not vital died.
I think I have a last question, if I can.
Oh, yeah, sure.
I don't know if it fits in, but I'm interested at how do you define health?
That just extending the conversation about different knowledge systems, it's been very interesting for me to have these dialogues and discussions with indigenous peoples. And one of the first things that really was an epiphany for me is that we talk about health as the absence of disease. But in most indigenous systems, health is a much broader concept. It's a concept of wellness, of vitality. It's not the absence of disease as much as a holistic well-being. And that well-being is not just created because I don't have disease in my body. It's because I live in a thriving community. I have connection to others. And, I have a fulsome life. I have meaning. I have purpose. These are different concepts of health. And Western medicine, because it operates, predominantly with outcomes, and doesn't pay enough attention to prevention, and also recognize that, prevention operates at different levels. So, we can have primary prevention, secondary prevention, tertiary prevention, and even primordial prevention, moving really, really far upstream. I think the biggest challenge for emerging practitioners and, some of the audience you're trying to reach through this podcast is we are so infatuated with dealing with outcomes. What about moving further upstream and trying to understand how we can enable, empower, and support wellness in individuals, and to realize that our healthcare system, our knowledge system, our Western healthcare system is just but one knowledge system. And how exciting is it to reach out and try and learn from other knowledge systems that have existed for millennia?
I think, thank you enormously for your time and for the discussion today. It's been really, really interesting, and I'm looking forward to sharing it with the wider community.
Thanks for the opportunity.
Yeah.